Next, I'm going to talk about the Crimean Congo hemorrhagic fever, abbreviated as CCHF. As mentioned previously, Crimean Congo hemorrhagic fever is a systematic viral disease, and its causative agent is norovirus, also known as Asian Ebola virus or Congo virus. The disease was first described in Crimea in 1944 and given the name Crimean hemorrhagic fever. In 1969, it was recognized that the pathogen causing Crimean hemorrhagic fever was the same as that responsible for the illness identified in 1956 in the Congo. The linkage of the two place names resulted in the current name for the disease and the virus. CCHF is an endemic in Africa, the Balkans, the Middle East, and the Asian countries at this time. The fatality rate of this virus is 10 to 40%. Going to begin talking about the disease mechanism of CCHF virus in animals and ticks. The hosts of CCHF include a wide range of wild and domestic animals such as cattle, sheep, and goats, also ostriches. Animals become infected by a bite of an infected tick. The virus then remains in their bloodstream for about a week, allowing the tick animal to tick cycle to continue when another tick bites the infected animal. Although there are a number of tick genera that are capable of becoming infected with CCHF virus, ticks of the genus Hyalama are the principal vector. I'm going to proceed about the disease mechanism of CCHF transmission to humans. CCHF virus is transmitted to people by tick bites, contact with infected animal blood or tissue during and immediately after slaughter. There can also be human-to-human transmission, which can occur by contact with blood, secretions, and organs or other bodily fluids of infected people. You can also see hospital-acquired infections of CCHF virus that occur due to improper sterilization of medical equipment, reuse of needles, and contamination of medical supplies. After infection by the virus, we see that various lengths of incubation periods depend on the mode of acquisition of the virus. So if you were bit by a tick, the incubation period will take anywhere from 1 to 3 days with a maximum of 9 days. If you were infected through blood or tissue contact, the incubation period is usually 5 to 6 days with a maximum of 13 days. Following, the onset of symptoms is usually sudden with fever, myalgia, dizziness, neck pain, and stiffness, backache, headache, sore eyes, and sensitivity to light. Also, a patient may experience nausea, vomiting, diarrhea, abdominal pain, and sore throat early on, followed by sharp mood swings and confusion. Following 2 to 4 days, the agitation may be replaced by sleepiness, depression. Abdominal pain may localize to the upper right quadrant. We also see clinical signs such as tachycardia. We may also see a petechial rash. It's a rash caused by bleeding into the skin on internal mucosa surfaces such as the mouth, throat, and on the skin. Petechiae may give way to larger rashes called ecchymosis. There is usually evidence of hepatitis, and severely ill patients may experience rapid kidney deterioration, sudden liver failure, or pulmonary failure after the 5th day of illness. The mortality rate from CCHF is approximately 30%, with death occurring in the second week of illness. In patients who recover, improvement generally begins on the 9th or 10th day after the onset of illness. We also see complications after the illness and recovery period of persistent joint pain, which can last up to months and years. The CCHF virus infection can be diagnosed by several different laboratory tests, such as the ELSA, as we spoke about before, antigen detection test, serum neutralization test, the reverse transcriptase polymerase chain reaction test, and the virus isolation by cell cultures. The treatment of CCHF is usually just general supportive care with treatment of symptoms. It is usually the main approach to managing CCHF in people. There's also the antiviral drug ribavirin, which has been used to treat CCHF infections with apparent benefits. It has been used both orally and intravenously and has been shown to be effective. There has also been a vaccine developed from mouse brain in Eastern Europe, but it's not a worldwide vaccine. I'm going to end by talking about the epidemiology of CCHF. CCHF was a disease, as previously stated, that was first described in Crimea in 1944 and given the name Crimean hemorrhagic fever. In 1969, it was recognized that the pathogen causing Crimean hemorrhagic fever was the same as that responsible for the illness identified in 1956 in the Congo. Thus, the name now Crimean Congo hemorrhagic fever. So, Crimean Congo hemorrhagic fever has been found in Eastern Europe, particularly in the former Soviet Union, throughout the Mediterranean, in northern Western China and Central Asia, Southern Europe, Africa, the Middle East, and the Indian subcontinent. So below I have attached a map from the WHO, World Health Organization, about CCHF. So we can see that the different colors represent different things. So the light yellow is the hemorrhagic vector presence. The brighter yellow is the CCHF virological or serological evidence and vector presence. The orange is the 5 to 49 CCHF cases reported per year, and with the dark red, or the red, we see 50 or more CCH cases that have been reported per year. And below are my references in which you can read through. I use the microbiology, the human experience textbook. I definitely use CDC and the WHO for much of my information. Thank you very much, and I hope you enjoyed this presentation.